Welcome to the lecture on the posterior shoulder muscles. This chart lists all the muscles that act at the glenohumeral joint. It is divided into anterior, posterior, and rotator cuff muscles. We have already covered 3 of the anterior glenohumeral joint muscles in the anterior shoulder lecture. These muscles were the pectoralis major, biceps brachii, and coracobrachialis. Be sure to review each of these muscles, their attachments, movements at the glenohumeral joint, and their innervation. In this lecture, we will move on to cover the posterior muscles that act at the glenohumeral joint. These include the triceps brachii, long head, teres major, latissimus dorsi, and deltoid. Note we did cover latissimus dorsi in the posterior shoulder girdle muscle group, as the latissimus dorsi does have movement at the scapulothoracic interface. We will cover this muscle again for its movements at the glenohumeral joint. The rotator cuff muscles, supraspinatus, infraspinatus, teres minor, and subscapularis will be covered in the next lecture. Triceps brachii. Triceps brachii, as the name indicates, has 3 heads: the long head, the lateral head, and the medial head. The long head of triceps brachii is the only portion of the muscle that crosses over the glenohumeral joint. Therefore, it is only the long head that has action or produces movement at the glenohumeral joint. The attachments of the long head of triceps brachii are the infraglenoid tubercle of the scapula and the olecranon process of the ulna. The movements that occur at the glenohumeral joint are primarily extension, but also some weak adduction of the glenohumeral joint. The triceps brachii is innervated by the radial nerve. Take this opportunity to pause the lecture to draw in your notes the attachment sites and fill in the muscle belly for triceps brachii. How does your drawing compare? Notice in this drawing, in purple, medially, you will see the long head attached to the infraglenoid tubercle of the scapula. And then lateral to that, in purple, you will see the lateral head of the triceps brachii. Under the purple, you'll see some red scribbles, and that is indicating the medial head of triceps brachii, which is deep to the long head and lateral heads. Latissimus dorsi. We already covered latissimus dorsi in the posterior shoulder girdle muscle group. Go ahead and review latissimus dorsi's attachments and the movements that it produces at the scapulothoracic interface. In this lecture, we are going to review the attachments again, only this time look at how the latissimus dorsi acts upon the glenohumeral joint. So, the attachments of the latissimus dorsi are the spinous processes of T7 through the sacrum via the thoracolumbar fascia, the iliac crest via the thoracolumbar fascia, the inferior angle of the scapula, the floor of the intertubercular groove of the humerus, and the crest of the lesser tubercle. The movements that latissimus dorsi produces at the glenohumeral joint include medial rotation, extension, and adduction. The innervation of latissimus dorsi is the thoracodorsal nerve. Take this opportunity to draw in the muscle attachments on the posterior aspect. Remember also the thoracolumbar fascia that the latissimus dorsi attaches to. When drawing the attachment of the floor of the intertubercular groove of the humerus and the crest of the lesser tubercle, you won't be able to see that real specifically here, but know that that muscle belly courses superiorly and laterally, but yet medial to the humerus. So in other words, the muscle belly, as it goes to attach to the humerus, will pass under the axillary region of the arm. How does your drawing compare? As you can see, the majority of the muscle belly is posterior to the medial lateral axis. Therefore, this muscle will perform glenohumeral joint extension. To help you further understand the muscle attachments and their movements, go ahead and draw in the muscle attachments and the muscle belly from this view, the lateral view. In this drawing, you'll be able to label the crest of the lesser tubercle, but again, remember the muscle belly will course medial to the humerus. How does your drawing compare? Because the muscle belly lies medial to the AP axis, this muscle will move the humerus medially, or in other words, it will adduct the shoulder. Take this opportunity now to draw in the muscle attachments from the anterior view, in particular the intertubercular groove attachment. How does your drawing compare? Try to see here too that the muscle belly actually crosses the vertical axis anteriorly, therefore will rotate the glenohumeral joint in a medial direction, or medial rotation. Teres major. Teres major's attachments are the inferior part of the lateral border of the scapula and the crest of the lesser tubercle of the humerus. Its movements at the glenohumeral joint include medial or internal rotation, extension, and adduction. Teres major's innervation is the lower scapular nerve. Take this opportunity to draw in the muscle attachment to the scapula. The attachment to the humerus you cannot see on this diagram, but again know that this muscle belly will run through the axillary region. So it will run medial to the humerus, similar to the latissimus dorsi. How does your drawing compare? From this posterior view, can you see how the muscle runs posterior to the medial lateral axis, therefore causing the humerus to move in a posterior direction, otherwise known as glenohumeral joint extension? Again, draw the muscle belly in now from a lateral view. Remember again that the teres major muscle belly courses medial to the humerus, similar to that of the latissimus dorsi. How does your drawing compare? From this lateral view, I hope that you can see that the muscle belly lies medial to the posterior axis, therefore causing medial movement of the humerus, otherwise known as glenohumeral joint adduction. This diagram is designed to help you understand the movement around the vertical axis. So in this picture, you can see the humerus to the right, and then the rectangular shape indicating the scapula to the left. And the red is the muscle belly of teres major. As you can see, the blue dot indicates the vertical axis. So as you can see, the muscle belly, indicated in red, is medial and starts anterior to the vertical axis. Therefore, this muscle will produce medial rotation about the vertical axis. Deltoid. The deltoid muscle is the most superficial shoulder muscle that forms the shape of our shoulder. It lies across the shoulder joint with both anterior and posterior fibers. Its muscle attachments are the entire length of the scapula, the lateral border of the acromion process, the lateral third of the clavicle, and then these fibers come together to then attach distally to the deltoid tuberosity of the humerus. The entire muscle belly will produce glenohumeral joint abduction. The posterior inferior fibers and the anterior inferior fibers will perform glenohumeral joint adduction. The anterior fibers produce flexion. The posterior fibers produce extension. The anterior fibers will produce internal or medial rotation, whereas the posterior fibers produce external or lateral rotation. The anterior fibers also produce horizontal adduction, whereas the posterior fibers produce horizontal abduction. The deltoid is innervated by the axillary nerve. If there is damage to the serratus anterior, the deltoid can also cause downward rotation of the glenoid fossa. This is because it is unopposed by the upward rotation of serratus anterior. We will not consider downward rotation of the glenoid fossa a primary movement of the deltoid because this is really only found in pathology. Take this opportunity to draw in the muscle attachments of the deltoid that you can see from the anterior aspect. And then go ahead and draw in the muscle fibers. Make that the anterior deltoid muscle fibers. How does your drawing compare? From this view, try to understand or picture that the anterior inferior fibers cross the AP axis inferiorly. Therefore, this would cause adduction. As far as the medial lateral axis, if you can picture the anterior fibers crossing anterior to the ML axis, this would therefore cause anterior movement of the humerus or glenohumeral flexion. Also from this view, if you can picture the vertical axis going through the joint, only this time see that the anterior fibers of the deltoid cross anteriorly to the vertical axis, therefore will produce internal rotation of the glenohumeral joint. Now take this opportunity to label the muscle attachments and draw in the muscle fibers from the lateral view. How does your drawing compare? Try to picture from this view the AP axis and how the fibers of the deltoid are superior to the AP axis, therefore will cause movement of the humerus in a superior direction, otherwise known as abduction of the glenohumeral joint. Now take this opportunity to draw in the muscle attachments and the muscle belly fiber orientation of the posterior fibers of the deltoid. How does your drawing compare? Now try to picture the different axes of the joint and how the posterior deltoid will produce each movement. So let's about the AP axis. And I want you to look at the inferior fibers of the posterior deltoid. Because these fibers lie inferior to the AP axis, this will cause adduction at the glenohumeral joint. Now picture the medial-lateral axis. Because the fibers of the posterior deltoid pass posterior to the medial-lateral axis, this will cause movement of the humerus in a posterior direction, also known as glenohumeral joint extension. Now picture the vertical axis going through the glenohumeral joint, and note how the posterior fibers of the posterior deltoid lie posterior to the vertical axis. Because of this, these fibers will cause external rotation of the glenohumeral joint around the vertical axis.